Liver cancer rates rising, ways to lower risk. Liver cancer diagnoses have increased about 2% per year since 2007, according to the American Cancer Society (ACS). In 2019, ACS predicts 42,000 new cases will be diagnosed and that almost 32,000 deaths will be attributed to the disease. In Michigan alone, liver cancer is the sixth leading cause of cancer deaths, reports the Michigan Department of Health and Human Services (MDHHS). Between 2008 and 2017, liver cancer mortality increased by 46% in the state. There are some measures that can be taken to lower risk, and they are being emphasized during October, the month designated as Liver Cancer Awareness Month. What the liver does. Among the important functions of the liver is removing worn-out cells and waste products from the blood. The liver also stores vital nutrients and filters and processes chemicals. These chemicals enter the body through food, alcohol and medications. The liver also produces bile. This substance helps digest fat and eliminate waste products. Almost all blood in the human body travels through the liver. Types of liver cancer. Cancerous tumors that develop in the liver itself are known as primary liver cancer. The most common primary liver cancer is hepatocellular cancer, often called hepatoma and designated by the abbreviation HCC. Secondary liver cancer is defined by cancer that starts in another part of the body and spreads to the liver. Among those may be colon, breast, pancreatic and other cancers. Who is most at risk? In the United States, chronic hepatitis B or hepatitis C infection are leading causes of liver cancer, making up 65% of factors contributing to liver cancer incidence. However, most people with hepatitis B or hepatitis C do not know they are infected because these infections rarely cause symptoms. The American Liver Foundation (ALF) states that liver cancer rarely occurs without reason. The liver generally experiences an abnormality. Such abnormalities include viral hepatitis B and C, the use of alcohol, diabetes and obesity. People who inherit certain metabolic diseases also run a higher risk of liver cancer. Ways to lower risk. There are ways to determine and lower the potential risk of liver cancer. It is important to keep physicians aware of current health so they may detect signs of hepatitis B and C. Additionally, the Centers for Disease Control and Prevention (CDC) offers an online hepatitis risk assessment that provides a personalized report. For individuals experiencing active infection with hepatitis B and/or hepatitis C, treatments are available that can reduce their risk of liver cancer. Hepatitis C treatments can cure more than 95% of persons infected with hepatitis C. There is a vaccine available for hepatitis B and it is recommended for all infants and those under age 19 who have not been vaccinated. It is also recommended for people sexually active with multiple partners and those exposed to drugs by injection. Lifestyle recommendations include exercise, a healthy diet and limited alcohol intake. Cirrhosis, or scarring, of the liver may result from overindulgence of alcoholic beverages. Treatment of liver cancer. When hepatoma is discovered in the liver, the part of the liver where it is contained can be removed. This procedure is called a resection or partial hepatectomy. The entire liver may be replaced with a transplant. Other treatment methods include radiofrequency ablation (RFA). This is a low-risk, minimally invasive procedure and is often used if a transplant cannot take place soon enough to help the individual. Chemotherapy and biologic and targeted therapy are also options. Biologic therapy is designed to stimulate the body's immune system to fight cancer cells. Another option, cryosurgery, involves using liquid nitrogen or argon gas to treat the tumor. Ask Dr. Haqqani. If you have questions about your cardiovascular health, including heart, blood pressure, stroke, lifestyle and other issues, we want to answer them. Please submit your questions to Dr. Haqqani by email at questions@vascularhealthclinics.org. Dr. Omar P. Haqqani is the Chief of Vascular and Endovascular Surgery at Vascular Health Clinics in Midland, www.vascularhealthclinics.org.